This is a question we've been hearing a lot, and I think you've addressed that quite a bit, but just to sort of reiterate, can you speculate what will happen to the ACA?
Well, I will say again, nothing is going to change soon. And actually, if you listen to all like MSNBC and Fox News when they interview all the policy wonks, they said what Kristina said earlier, that basically they want to set aside changes in health care. I think they're moving on to focus on tax reform, and they're going to let this sit for a while. But it's very difficult to separate the rhetoric from the fact, and there are many people still talking about, well, we should do this, we should do that. So the bottom line is I don't think the ACA is going anywhere. It's not going to explode or implode. When it was passed, they knew there was going to be periodic adjustments, just like Social Security. I think, Kristina, you checked, and there was 28
amendments.
28 amendments made to the Social Security program over its lifetime, and the ACA is going to be the same way. And it's going to be a very slow-moving albatross. Maybe that's not a good analogy, but it's going to be very slow-moving, and it's going to take time. And
well,
I'm sure
I think the projections of potentially 24 million people in the next decade losing health insurance, and we'll be back to over 50 million people uninsured by 2026.
Right.
Things are going to happen to make sure that doesn't happen. Or we're already talking about a congressional bloodbath at the midterm elections.
Right.
Because I think the one thing that this deliberation on the Reconciliation Act did is it did help elucidate what the on-the-ground features of the Affordable Care Act are for the voters, for the American public. And so, you know, if I could just take the broad stroke and reiterate what Phil said, nothing's going to change quickly, or certainly not in the life of this edition of this book that is huge. We're going to, I think, end up building off of the principles of value versus volume care, incentivizing physicians for quality, all the things that cross over between the ACA and MACRA, but keeping in mind that this is a monstrous $3+ trillion system. We don't turn the Queen Mary at a right angle on a dime. And so this is going to take years of deliberation and legislative activity in order to finally settle in as the way we finance health care. I would just remind everybody to think about the fact that in 1995, we were talking about the new traction gained by managed care. Managed care is now the way we support health care in this country. Managed care is the insurance mode for health care in this country. 25 years, 20+ years. So things will continue to evolve. It's an extremely interesting time for anybody who's interested in the healthcare delivery system, but flip the switch changes are just very unlikely.